In her childhood, 21-year-old Sydney Flores was inspired by how nurses cared for loved ones who passed away. Now she's been accepted by the nursing program at the University of British Columbia.
I really witnessed the compassion and kindness of nurses, and I thought to myself, that's what I want to devote the rest of my life to doing as well.
There's never been more admiration for nurses, with the pandemic forcing them to work in unbearable conditions. They're among more than 66,000 healthcare workers becoming infected with COVID-19 and dozens dying. But universities are reporting an increase in students applying to enter nursing schools. Applications at UBC have gone up from 500 a year to 800. And many nursing students say the pandemic only strengthens their resolve.
You hear the nurses talking about just how awful it is. Sometimes definitely the nerves come in and I get a little bit scared to jump into it. But for the most part, I'm pretty eager to get out there and start helping out.
COVID has highlighted the different longstanding inequities in our healthcare system. And moving forward, I think that's something I would like to work in combating those systemic inequalities.
Facing a predicted national shortage of 60,000 nurses by next year, universities are switching to accelerated programs.
With our new curriculum, those coming in directly from high school can finish the program in 3 years. It's 3 calendar years compared to 4. In the past, it would have been 4 what we would call academic years.
There's plenty of goodwill. During National Nurses Week, the Prime Minister and many others posted thank you messages. But Canada's largest nurses organization says attracting enough new nurses to offset pandemic burnout and attrition requires much more than kind words.
Why don't we just give free education for healthcare workers, healthcare professionals throughout the country for 4-6 years until we get over this bump? She's glad help is on the way, but doubts it will be enough to prevent a healthcare crisis from becoming even worse. Ross Lord, Global News.